the controversy of microneedling radiofrequency is whether it melts fat. I tell people it's like you're constantly in a fight against the sun your entire life from birth to death. And this is just one of the tools that's helping you fight the fight, but you're not going to win the fight.
What's the difference between erbium and CO2? And then let's talk about the different erbium options.
Because Toronto is so multicultural, I felt that we should have a device within our practice that was the best possible treatment for darker skin patients. About 5 days downtime.
That was my next question. You just keep taking all my questions. I wanted to ask two questions.
Hey guys, Dr. Solomon here. I want to welcome you back to another episode of Unfiltered. This is our podcast where you get an unfiltered sense of facial plastic surgery. And today we're going to talk to you about questions relating to energy devices.
All right. Hi, everyone. So today we're going to talk about energy devices, which includes microneedling, laser resurfacing, phototherapy, sound therapy. So there are lots to choose from on the market. And Dr. Solomon, my question for you is, how do you select the ones that you've got in your practice? Because there's lots out there. Some are better than others. How do you decide?
You know, it's a bit of a journey. I started buying energy devices in my practice over 2 decades ago. The first device that I bought was a CO2 Laser, and that machine was considered the gold standard of facial skin resurfacing at that time, and it probably still is considered the gold standard of facial resurfacing. I went out to Calgary and spent some time with a very well-known laser expert, a dermatologist known as, his name was Kent Remington. One of the companies that I'd purchased the machine from had sent me out to get trained on it. And he had a number of devices. And I went through his office and sort of adopted some of the devices that he was using at that time in his practice. So that made me add to my
portfolio.
Tools, my portfolio. I shortly after getting the CO2 added in an Erbium device, and I'll tell you why in a minute. Then later we added some microneedling devices, and we added a Pico device, and so we have a number of different devices. Different manufacturers have some competing devices with some slight differences amongst them, but in terms of the categories of energy devices, a lot of it depends on the actual energy source. So CO2 is one, erbium is another. There's a YAG laser, PicoSure. Pico is a trade name, but Pico laser. And then there's all the needling devices, which are a newer device that have overlapping applications for anti-aging. And they're all really to resurface or improve your skin quality.
So we're going to run through them, and we're going to talk about the ones that we have, what they do and what they treat, and who are the best candidates for them. Okay, so we're going to start off with CO2 laser since you've already touched on it. What does it treat, and who are the best candidates for it?
So CO2 laser is a resurfacing tool. It's useful for patients who have a myriad of issues relating from texture changes to their skin, photo damage to the skin, which is sun damage, fine lines, wrinkles, and also things such as rosacea, early rosacea, rhinophyma, where the skin on the nose starts to get enlarged, under eye resurfacing for fine lines under the eye. It's a terrific tool.
How about for nose slimming?
Nose slimming, we do use it for as well. Nose slimming is sort of to shrink and add some heat into the tissues of the nose to contract some of the overlying skin envelope. We do use that for rhinophyma, early rosacea, or some patients who just have a bit of thicker skin, and it seems to help as well.
And what skin tones are candidates for this?
So generally speaking, we use it on lighter skin tones. So there's a Fitzpatrick classification of skin types ranging from light to dark skin. The darker end of the spectrum would not be great candidates for CO2 laser resurfacing because the heat from the laser potentially could affect the melanocytes, causing pigment change. So we don't use CO2 on darker skin patients. The darkest patients that we've used it are East Asian patients, Asian patients who have acne scars and have tried other devices. And when we do it on those patients, we're putting them on topical therapy to try to reduce the chance of
a brightener.
To prevent any like hydroquinone type of things, to prevent any delayed hyperpigmentation or hypopigmentation, which can occur from laser resurfacing.
I'm just going to mention this just because we're going to start talking about erbium next, but each device sort of has varying settings. So You can modify how deep you go or how aggressive you go. So then there's erbium, and then there's different treatments that we do with the erbium. So let's start. What's the difference between erbium and CO2? And then let's talk about the different erbium options.
Sure. So CO2 and erbium are both resurfacing devices. They have some different applications and different energy sources.
So this is all for skin resurfacing. Just want to be specific to what we're talking about.
All for facial skin resurfacing.
Okay.
The erbium, in a nutshell, is a competing device to the CO2, meaning that there is some overlap, but it has some advantages and some disadvantages. The primary advantage of erbium laser is that it doesn't produce as much heat as a CO2. That being said, there are some modifications to it which almost mimic a CO2. So some offices which only have one device may choose an erbium device and buy one that has the ability to almost mimic or modify its settings to seem similar to a CO2. And that's a really reasonable thing to do. But in our practice, where we have both devices, we're using the CO2 for often laser resurfacing of the eyelids and the facial skin, but we're not using it as much for darker skin patients. We use the erbium laser for resurfacing, and I find it preferable for whatever reason for the area around the mouth.
The deeper lines and wrinkles.
Yeah. So when you do a deep CO2 laser around the mouth, in the past, there would be some pigment issues. You see many patients who have really smooth skin around their mouth who are like in their 70s and 80s, and they often tell you, I had a CO2. And if you look closely at them, they will have really nice results from perioral lines, but they often have pigment change. They often look white around their mouth, and they just have accepted that and used makeup to camouflage. The erbium device is very similar to CO2 for resurfacing the area around the mouth, but does not seem to cause hypopigmentation. So around the mouth resurfacing, especially deep lines, my preference is the erbium. For eyelid resurfacing, I personally like the CO2. So just the way that the mechanics of the machine seem to deliver the energy, that's how I use it in my practice. Practitioners who only have one or the other device will utilize the devices with specific settings to get the best results they can with the one machine.
Okay, so another question about erbium. Under the erbium umbrella, there's micro laser peel, nano peel, halo laser, like there's different options. Explain what the difference is between them all.
Okay, so this is with reference to the device that we have. Each device has its own sort of terminology, but in a nutshell, the erbium device and the CO2 have different settings. They also may have different handpieces and delivery systems. So within the erbium category, we have a fully resurfacing laser, a ablative laser, where we do around the mouth, and we can go very, very deep, or we can go very superficial. If we go very, very superficial, just a surface type of peel, we call it, the terminology we use for that is an erbium micro laser peel. That's equivalent of almost like a chemical peel.
I was just going to ask, is that like a chemical
peel? It's like
peel?
a chemical peel, but we're using the laser. So that may be a younger demographic or someone who just wants to have an exfoliation of their skin. Again, you can go a little bit deeper and get some resurfacing, lifting of some of the dead skin or the pigment in the skin. And it may have a very short recovery. So the more superficial, the less of an impact it's going to have, but less of a downtime. So the Halo device is specifically a trade name that's applied to one of the delivery systems where it takes the erbium laser beam and delivers it in a way that it's fractionated, broken up, pixelated, resurfacing. It's going to have a little bit of ablation, meaning it's going to evaporate some of the outer layer of the skin, and it's going to be delivering a little bit of coagulation or heat into the tissues for some tissue remodeling. So it's a nice sort of in-between mid-level laser, which has about 5 days downtime.
That was my next question. You just keep taking all my questions. I wanted to ask two questions: downtime and sun avoidance. What is summarize that for me? How much downtime do you need, and how long do you have to stay out of the sun?
So it really depends on which device you have. Depends on your own skin type and how you respond to treatment. Some people are more sensitive than others. If you undergo a CO2 with a aggressive CO2, you may have a recovery of over 1.5 weeks. Erbium, similarly, if you have a deep erbium peel around the mouth, resurfacing, we could do different depths from 100 to almost 400 or 500 microns, which is how deep we go in the skin. You may be red around the mouth for months. We have to use makeup. We have special makeup to camouflage it, but that's going to give you've seen like the best results. Sun avoidance is essential after the laser. We don't want people coming for the laser who've undergone a lot of tanning either. So we want to avoid it before and after, but it is essential that you don't get a lot of sun. Your skin will be sensitive.
Can you go in the sun again?
It's not, you can, I mean, listen, people get lasers who live in Miami and
Yeah.
Sydney, Australia. So there's no way to avoid the sun, but you have to wear sunscreen,
Hat,
big hat, and avoid it.
glasses.
You've invested your money and energy in
Yep.
restoring your skin. You don't want to just sort of damage it with
Yeah.
it. I tell people it's like you're constantly in a fight against the sun your entire life from birth to death. And this is just one of the tools that's helping you fight the fight. But you're not going to win the fight. You're just fighting the fight. But it definitely is.
Good line.
It's essential, though, to be adding these in at some point. The more sun you have, the more energy devices you need to reverse it. If you've worn sunscreen your whole adult or childhood and adult life, which most people have not, worn a hat and avoided lots of sun damage, then you're not going to need the energy devices as much.
What's interesting, we've got a camera in the office. It's the Reveal camera, and that can show how much sun damage somebody has underneath the surface that you can't see, which is really cool. So you guys can all come on in and give it a shot and see what it looks like. I actually did a picture with my daughter when she was about 16 or 17, and I wanted to see what mine looked like because I'm in my 50s. And it's amazing what pure, innocent virgin skin looks like. It barely has any pigment on it compared to mine. It humbles you. It makes you think twice about going in the sun. That's for sure. So let's talk
on that topic, though. I think that having the photo documentation, specifically with the more advanced technologies than a regular camera, allows us to objectively track the results. Because we have patients who get, one energy device and they say they don't really see much change, rarely. And sometimes you're not sure, but you go back to the photos, especially with the Reveal software, you can sort of really compare and map out how they're doing in terms of like reducing some of the photo damage. So,
yeah, it's interesting. That's for sure. Okay, so let's talk about another laser technology that we have. We're going to move along. So for brown pigment, people who don't want as much downtime, it's called a Pico laser. We offer that, and it addresses sun damage, freckles, birthmarks. Maybe tell me a little bit more about that.
Yeah, the Pico is one of the newer devices that we added into our toolbox of lasers, and we added in about 4 or 5 years ago. And it was unique in that it was good for all skin types, almost all skin types. And it's got no downtime. It's got a rejuvenative aspect to it. And it's very, very safe. So I liked it. I added it in because not everyone wants to have any downtime. So energy devices such as Erbium or CO2, you're going to have some downtime. IPL, which is intense pulse light, which we also offer, which was sort of the standard anti-aging sort of maintenance type of skincare treatment, had some limitations for certain skin types. So for very light skin types, IPL worked very well for the browns and the reds. But for medium skin types or darker skin types, IPL, I thought, actually made the pigment often worse. It almost put heat into the tissue, created a bit of an area around the area that you were targeting that looked almost more brown. So for people who are sort of Mediterranean basin, Middle Eastern, Asian, who were in need of some anti-aging solutions for some of the early changes of sun damage, IPL was not, a device that you could use universally on everyone. That being said, many people, that's their only device, so they use it universally, and they have some very happy patients, but some disappointed patients. So because Toronto is so multicultural, I felt that we should have a device within our practice that was really safe and cutting edge and the best possible treatment for darker skin patients. And that's why we brought in the Pico.
I have to say this about Dr. Solomon. He has, I guess, what they used to say, Cadillac taste. So he likes the best of the best. So I do say that whatever he picks, he's done his research. He knows they're tried and true to a certain degree. Obviously, patient selection plays a role, but he picks state-of-the-art technology. So whatever's the newest and the best, he likes to have.
Yeah, listen, we try. I mean, there are a lot of good devices out there, and some of I think the competition in the marketplace has elevated a lot of the competitors to create some good devices. The ones that we've chosen, I don't want to say they're the best on the market, but some of them are from the larger manufacturers who've been in the industry a long time and have, done a lot of R&D and spent a lot of money in developing the best technologies that are available. But look, in 10, 15 years, a lot of these devices will have been replaced by newer and better devices.
It's always the way it goes. So let's talk about microneedling with heat. We want to talk about the technology that we have and maybe a little bit of controversy that surrounds it as well. So let's discuss.
Yeah, so Morpheus, which is one of the devices that we have, which is a trade name. There's lots and lots of competitors now with different banners and names to describe their microneedling, and some of them have computers attached to them that are sort of tracking the heat and the energy and recording exactly the fluence of the skin and resistance and all sorts of things. But bottom line is you're taking a mechanical needle, which is a known anti-aging treatment, piercing through different layers of the skin and adding in heat. So you're adding it in through radio waves, and it's either going to be unipolar, meaning it's like each tip of the needle is going to have some energy coming out of it, or it's going to be bipolar, where it's going between the different points. So the square device that's being inserted into the skin may have 24 pins, and you may have the heat sort of bouncing between them. That would be bipolar rather than just coming out the tips, which would be unipolar.
24 pins go into your face. How deep?
Depends on the device and depends on the settings that you want. So we can adjust accordingly. So some of it really does depend on the the training and the education of your provider. So we have energy device technicians that work in our clinic who have undergone lots of training and have lots of experience, because we've had,
which is really important. Really important.
Yeah, I think that you can have the device and then you can have the
Yeah.
provider. And if the provider is a novice, they may have the same device but not necessarily deliver the same results.
Which could lead towards the path of complication or the topic that I was going to say that we're going to discuss.
Yeah, listen, I think the vast majority of these devices that we're talking about are, the lasers are called class 3 lasers. You have to have people with significant education.
Really important to
There's a
know.
lot of liability with using these machines, and they're not available at every sort of medical spa type of environment. They're really medical grade lasers. Then there's the energy devices that are microneedling. Those seem to have become very popular, and they're safer to implement. For instance, you can't damage someone's eyes like you can with lasers. So that could be in a med spa, attached to a hair salon, attached to different things that are sort of safe to use. The environment allows
mouse.
for it. Patients are there for other beauty needs, and it's reasonable to offer those. So they've become extremely popular. They're also less expensive, those devices, than some of the heavy duty lasers. And the results are quite good. Like, they become popular for a reason. You can really improve skin quality with the microneedling radiofrequency. But again, you have to pick the right patient, the right indications for the treatment, and you have to have a good provider providing safe, care. The controversy of microneedling radiofrequency is whether it melts fat, and different doctors are going to say different things. The second thing is whether it actually lifts and tightens the tissue. So our general belief is it's another device to improve skin quality, texture, tone of the skin, to improve it. It's not really going to be lifting your face like surgery or a facelift will do, but it's great in conjunction. So we utilize it in
What's your
patients.
opinion about melting the fat, though?
In terms of melting fat, I will be honest with you. We've had many patients come in and tell us they've had their fat melted, but I've honestly never seen it from our own patients. So I almost feel like it may be the settings that are being used maybe in other facilities. Maybe they're turning up the energy too high and they're putting it in too deep, too high, or they're stacking the thing, meaning that they're putting the needle in multiple times in the same spot. Our device, you can stack it up to 3 times. You can stack it more if you just leave it on the same spot and reshoot, but 3 times is sort of one of the standard settings. But if you go 3 times and then leave and do another 3 times, you may be doing some bulk heating, which could cause some fat atrophy.
Okay,
underneath
there's your
it.
answer.
But I think if you're following protocols and not stacking and being cautious with it, I haven't really seen fat atrophy in our practice. And we were certainly one of the first 3 or 4 clinics in Canada to get the device.
Okay, there you go.
So guys, I hope you found that energy device podcast helpful and informative. It's such a big topic. We can certainly come back and talk more about it. Send in some questions to us.
Yeah, that would be helpful too. Yeah.
Yeah, and we'll see you guys soon in the new year.